My name is Dr. Will Posten, and I'm a Mohs surgeon at Advanced Dermasurgery Associates, part of Platinum Dermatology here in Dallas, Texas. I've been practicing here for 22 years and mostly focusing on skin cancer, and we also do surgical dermatology as well, which includes the treatment of keloids. Yeah, thanks for the question. So, you know, when I was in training, and this is, gosh, like almost 30 years ago, there were only two treatments for keloids, and I was basically either doing steroid injections or doing an excision of it. And those both had issues, basically. Steroid injections, textbooks will say they work 5 or 10% of the time, and they kind of shrink it a little bit, but they wouldn't get rid of the keloids. Whereas excisions, textbooks would say they would work about half the time. And the challenge with them is that keloids oftentimes get worse with trauma. By excising it, you're introducing trauma, and about half the time or so, they'd come back bigger than they were prior to treatment. So these were the challenges we had with what was available when I was in med school and residency. And over the last 5 or 10 years, we've started using excisional therapy with radiation immediately following. And I think to this day, a lot of dermatologists are still not familiar with this. But basically, using this technique by cutting it out with a precise surgical margin, removing all the keloid, and then using radiation to inhibit any inflammation, any fibroblast growth that would occur to kind of recreate the keloid. By doing that, there have been studies that have shown that we have a 90% cure rate with doing this. And this is what we've seen in our clinic. And this is super exciting for me. So we have this technology that was not commonly available or readily available when I was in training. And now we're doing this on a daily basis. So very exciting for me. We've done this on, all sorts of locations. Locations are not a issue with this. That being said, obviously areas under high tension, like the chest or back, can recur more often. And just, normally, even when they're not keloids, those are difficult areas to treat surgically. But ones that tend to do really well are ones that are, on the ear or facial ones on the neck. Those tend to have a much greater success rate when we do this technique. In terms of skin type, most people who tend to get keloids tend to be, have darker pigmentation. Maybe Fitzpatrick skin types 4, 5, and 6 tend to be the ones that we see more often. But actually, we've used this modality with all types of skin types, and it tends to be equally effective with all.